Getty stock. The most common cause of dizziness is a problem with the inner ear. They only last a second or two but occur frequently and are enough to make my head spin. I make sure I drink enough fluids, so I'm fairly sure it's not dehydration and my blood pressure is normal. What else could be causing this and what can I do about it? The most common cause of dizziness is a problem with the inner ear, which controls balance. Inflammation from a viral infection is often to blame, or sometimes tiny crystals can form within the fluid inside the ear and cause vertigo. However, the fact that you also feel lightheaded suggests the cause is from elsewhere in your body rather than your ears. The list of possible causes includes anemia, or a problem with your heart rate, for example, going too fast, too slowly, or missing beats. And although your blood pressure was normal when it was checked, it may suddenly change when you go from lying to standing, a condition known as postural hypotension. The only way to sort this out is to see your GP, who will probably need to examine your ear and your pulse rate and perhaps organize some blood tests and an electrocardiogram (ECG) test that can be used to check your heart's rhythm and electrical activity. Getty stock. The most common reason for mucus in the throat is secretions tracking back from the nose. I get irritating mucus in my throat. Can you tell me how I can prevent it from happening? The most common reason for mucus in the throat is secretions tracking back into the throat from the nose. Inflammation in the nose is usually to blame, and the most common cause is a viral infection. Many people find they get mucus in the throat when they have a cold. If the infection spreads to the sinuses, then the problem may persist for several weeks. More persistent inflammation of the nose is usually due to allergy, and many people with hay fever find they're constantly clearing the throat. However, allergic rhinitis doesn't just happen in summer, it can happen in the autumn, triggered by molds, or year-round, caused by house dust mites, or other unidentified allergens. Some people find that a change of temperature at doing sport can set the nose running. The best treatment for persistent allergic rhinitis is usually a steroid nasal spray, containing fluticasone and mometasone. These can take several weeks of regular daily use to take effect, so don't expect instant results. Mucus in the throat can also be caused by acid reflux from the stomach. Other symptoms of this are heartburn, especially when lying down, and discomfort behind the breastbone. This can usually be treated with tablets that reduce production of acid in the stomach, which are available on prescription from your GP. Getty stock. Statins can cause muscle inflammation. I was prescribed atorvastatin 3 months ago. For the past 3 weeks I have had a lot of pain in my legs. Could it be connected to my statin? To complicate matters, I had just been on a 4-hour flight. All statins can cause muscle inflammation, and although there has been a lot of publicity about this, it's not actually the common. In clinical trials, less than 1% of patients taking statins reported muscle pain, but along with most doctors, I suspect that about 2 or 3% of people taking statins will have some degree of muscle pain. A blood test for the enzyme creatine kinase can show if your muscles have become inflamed. But a simpler way of finding out if your medication is to blame is to stop it and see if the pain disappears. But talk to your GP before you do this. If the pain does ease, it's worth trying a different statin, starting at a low dose. Many patients find they can take one statin but not another. The main risk from flying is developing a deep vein thrombosis (DVT) in your legs, but this will cause swelling and redness, rather than just pain, and it would be unusual to get a DVT in both legs at the same time. But if you have got any swelling, you should see your doctor as soon as possible. If you have a health question for Dr. Rosemary, please write to her in confidence at the Northern Shell Building, 10 Lower Thames Street, London EC3R 6EN, or email health@express.co.uk. Dr. Rosemary's reply will appear in this column. She regrets that she cannot enter into personal correspondence and that due to the volume of letters she cannot reply to everyone. Find out more about Dr. Rosemary at rosemaryleonard.co.uk.